I'm Dr. Balaji Jaganmohan. I'm a practicing diabetologist at the Apollo Sugar Clinics at Padmanabha Nagar and JP Nagar in Bangalore. Today I want to talk about a condition called diabetic foot ulcer or diabetic foot wound, which is seen in certain individuals that run the risk of developing a foot ulceration. So what is this diabetic foot ulceration? It's nothing but a small wound or an ulcer that can develop either on the sole of the feet, or it can develop on the front surface of the feet, what we call the dorsal surface, or it can even occur somewhere higher up on the leg. Now, what are the risk factors for a patient to develop diabetic foot ulceration? The most important in India is diabetic neuropathy. So if there's nerve damage to the peripheral nerves, then the person can develop a small wound on the sole of the feet. There is another condition called autonomic neuropathy, where it can lead to dryness, cracks and fissures in the feet, and that can also lead to foot ulceration. And something called motor neuropathy, where there can be deformities in the feet which can increase the risk of something called trophic ulcers or pressure-induced ulcers on the weight-bearing areas on the sole of the feet. Apart from this, also another condition called peripheral arterial disease, where there might be occlusions in the arteries of the leg, and that can lead to a foot ulcer on the front surface of the feet. Apart from this, also if the person has got uncontrolled sugar and if they have a shoe bite or any trauma to the feet, that can also develop a small wound. So it is important to check for peripheral neuropathy, motor neuropathy, autonomic neuropathy, the presence of peripheral arterial disease, and try to pick up these risk factors that can increase the risk of developing a foot ulceration. And of course, without saying, you have to understand that blood sugar control is very, very important for preventing or getting a foot ulcer treated. Now, looking at the feet is very important. If you have any foot deformities, if you have any discoloration in the feet, if there is loss of hair, if upon touching your feet you feel that it has become cold, then that is an indication that you might develop a foot ulceration, and you might have to get your feet evaluated, and you have to get in touch with your treating physician so that those risk factors can be controlled and a diabetic foot ulcer can be prevented. Now, just in case if a foot ulcer develops, then there are 5 things that are important to treat that foot ulcer adequately. Number 1 is metabolic control, that is good sugar, blood pressure, cholesterol control. Second is mechanical control, that is using diabetic footwear, what we call offloading, so that the ulcer can heal faster. The third is microbiological control, and that is using antibiotics so that if there is an infection, then the bacterial pathogen can be eliminated. The fourth is vascular approach. So we need to ensure that there is enough blood supply to the feet. If there is occlusion, then it has to be revascularized. And the fifth one is offloading. So if these measures are done adequately, then the person can take care of the foot ulcer, it will heal faster, and we should prevent the future risk by keeping all the risk factors under control. Thank you.